Alzheimer's disease. Alzheimer's disease is a progressive brain disorder that causes memory loss, confusion, and death by gradually destroying neurons, especially in areas critical for memory and reasoning. It is the most common form of dementia and a major cause of death in aging populations. The disease is marked by the buildup of abnormal proteins in the brain, beta-amyloid plaques outside neurons and tau tangles inside them. These toxic structures disrupt brain signaling and cause widespread brain atrophy. Early symptoms include forgetting recent events, repeating questions, or misplacing items. As it advances, patients lose language, judgment, and the ability to recognize loved ones. In late stages, they become bedridden and dependent on full-time care. Death often results from infections like aspiration pneumonia. Alzheimer's typically begins after age 65, though early onset cases can occur in the 40s or 50s, often due to genetic mutations. There is no cure. Current treatments offer only modest symptom relief. As life expectancy increases worldwide, Alzheimer's and other dementias are increasing in prevalence. Once relatively rare simply because people didn't live long enough, Alzheimer's is now one of our deadliest diseases by sheer scale. But unlike an acute illness, it's a prolonged and progressive condition. Amyotrophic lateral sclerosis, ALS. ALS is a fatal neurodegenerative disease that destroys motor neurons, nerve cells in the brain and spinal cord, responsible for controlling voluntary muscles. In children or young adults with extremely rare early onset forms, this leads to rapid muscle wasting, paralysis, and eventual respiratory failure. The disease is driven by multiple overlapping mechanisms, including toxic buildup of glutamate, damage from unstable oxygen molecules, and malfunctioning mitochondria. Faulty genes like SOD1, C9orf72, and TARDBP are implicated in about 10% of the cases. The rest happen without clear family history. ALS progresses relentlessly. Most patients die within 3 years, typically from failure of the muscles that control breathing. While most common in adults, its rapid and irreversible nature makes even rare childhood forms devastating. Stephen Hawking is one of the most well-known ALS patients, who lived 55 years after diagnosis. Lou Gehrig, first baseman for the New York Yankees in the 1930s, is another famous example of ALS. FDA-approved therapies like tofersen are now targeting genetic subtypes, but there is still no cure.
Metachromatic leukodystrophy, MLD.
MLD is a fatal genetic disorder that destroys the protective myelin sheath surrounding nerves, leading to severe, progressive brain and nerve dysfunction. It is caused by autosomal recessive mutations in the RSA gene, which leads to deficiency of the aryl sulfatase A enzyme. Without this enzyme, fatty compounds called sulfatides accumulate in the brain's white matter and peripheral nerves, causing widespread demyelination. This disrupts nerve signal transmission and leads to steady neurological decline. The most severe form, late infantile MLD, begins between 6 months and 2 years of age and progresses rapidly. Affected children initially develop normally, but then lose skills. Walking becomes clumsy, speech deteriorates, and muscle tone drops before shifting to stiffness and spasticity. Seizures, blindness, and cognitive loss follow. Late infantile MLD leads to paralysis and death, usually by age 5. Juvenile and adult forms follow similar patterns at slower rates. Though stem cell transplants and gene therapy, LibMeldy, show promise when given before symptoms, there is no effective treatment once damage begins. Prevalence is roughly 1 in 40,000 to 1 in 100,000 births.
Huntington's disease.
Huntington's disease is a fatal genetic brain disorder that slowly destroys motor control, cognition, and personality, making it devastating when it appears in childhood or early adulthood. It is caused by a mutation in the HTT gene on chromosome 4, where an abnormal expansion of CAG nucleotide repeats produces a toxic Huntington protein. This protein accumulates in neurons, particularly in a region called the basal ganglia, leading to their gradual death. The earliest brain changes can be seen as atrophy of the caudate nuclei on MRI. Huntington's causes a triad of worsening symptoms, involuntary jerking movements, severe psychiatric disturbances like depression or aggression, and progressive dementia. Huntington's is rare, affecting 4 to 15 people per 100,000 in populations of European descent. It is inherited in an autosomal dominant pattern, so children of an affected parent have a 50% risk. Though most cases begin between ages 30 and 50, rare juvenile forms can appear in childhood. There is no cure, and life expectancy after symptom onset is 15 to 20 years. Krabbe disease. Krabbe disease is a deadly genetic disorder in infants that causes rapid destruction of the brain's white matter, leading to loss of movement, blindness, deafness, and death, often by age 2. It is caused by mutations in the GALC gene, which results in a deficiency of the enzyme galactocerebrosidase. Without this enzyme, toxic lipids like psychosine build up, especially in cells that produce myelin, the insulating layer around nerves. This causes widespread demyelination and severe brain damage. The disease is inherited in an autosomal recessive pattern. Symptoms begin around 3 to 6 months of age with irritability, stiffness, and developmental regression. Infants lose motor abilities, become hypersensitive to touch, and develop muscle spasms and seizures. As the disease advances, they lose the ability to see, hear, move, or swallow. NFL quarterback Jim Kelly's son, Hunter, was diagnosed with Krabbe disease and lived to age 8, raising national awareness. Without early stem cell transplant, most infants die by age 2.
Tay-Sachs Disease.
Tay-Sachs disease is a fatal neurodegenerative disorder in infants caused by a missing enzyme that leads to toxic buildup in brain cells. It is deadly because it causes rapid, irreversible damage to the central nervous system in early childhood, leading to paralysis, blindness, and death, usually by age 4. Tay-Sachs is inherited in an autosomal recessive pattern. Both parents must carry a mutation in the hexa gene for their child to be affected. The missing enzyme, beta-hexosaminidase A, normally breaks down a fatty substance called GM2 ganglioside in neurons. Without it, GM2 accumulates, gradually destroying brain cells. Infants with Tay-Sachs appear normal at birth, but between 3 and 6 months of age, they begin to lose developmental skills. Common early signs include muscle weakness and decreased vision. In the general U.S. population, Tay-Sachs affects about 1 in 320,000 births. Carrier rates are much higher in certain groups. About 1 in 25 Ashkenazi Jews carry a hexa mutation, along with elevated frequencies in French Canadian and Pennsylvania Amish communities.
Leigh Syndrome.
Leigh syndrome is a rare but devastating genetic disorder that causes progressive destruction of the brain's energy systems. Most often appearing in infancy, it stems from defects in mitochondria, the tiny power plants inside cells, leading to failure in energy production, especially in high-demand areas like the brainstem and basal ganglia. Over 75 genes can be involved, and the inheritance pattern may be mitochondrial, that's passed from the mother, or autosomal recessive. After a seemingly normal early infancy, children begin to regress, losing motor milestones, struggling to eat, breathe, or move normally. Symptoms include hypotonia, floppy baby, vomiting, abnormal eye movements, seizures, and metabolic crises triggered by infections or stress. On MRI, symmetrical brain lesions reveal the destructive path of the disease. Most children with early-onset Leigh syndrome lose abilities like head control and swallowing within months, eventually becoming completely dependent and at high risk for respiratory failure. Leigh syndrome is rare, occurring in about 1 in 40,000 births. There's a higher frequency in populations with founder mutations. For example, certain Quebec populations may be more prone to Leigh syndrome due to LRPP-RC gene mutations.
Sanfilippo Syndrome.
Sanfilippo Syndrome, also called MPS III, is a devastating neurodegenerative disorder often referred to as childhood Alzheimer's because of its profound cognitive decline. It stems from a deficiency in one of 4 enzymes needed to break down heparan sulfate, a cellular waste product that builds up primarily in the brain. Although affected children may initially seem healthy, signs usually emerge between ages 1 and 4, beginning with speech delays and behaviors resembling ADHD or autism. As the disease progresses, cognitive and motor regression becomes severe. By adolescence, most are nonverbal, wheelchair-bound, and suffer from seizures. Other noticeable symptoms of Sanfilippo syndrome include short stature and coarse facial features, which may look like very thick eyebrows and full lips. Children with this condition can also have joint problems, gastrointestinal issues like chronic diarrhea, hearing loss, and vision impairment. Sanfilippo syndrome is rare, occurring in roughly 1 in 70,000 births. There is no cure. Most children with Sanfilippo die in their teens or early 20s. Clinical trials are exploring gene and enzyme therapies, but nothing has yet proven effective at halting progression.
X-linked adrenoleukodystrophy, X-ALD. X-ALD is a fatal genetic disorder in children that rapidly destroys the brain's white matter, leading to severe disability and death within a few years of symptom onset. It is caused by mutations in the ABCD1 gene on the X chromosome, which impair the body's ability to break down very long-chain fatty acids. These fatty acids build up, especially in the brain and adrenal glands, damaging the myelin sheath that protects nerve fibers. As myelin is stripped away, brain function declines quickly. The disease primarily affects boys between ages 4 and 10, often starting with behavior changes, vision loss, or coordination problems, and progressing to seizures, blindness, and total dependence. Adrenal glands also fail, requiring steroid replacement. Hematopoietic stem cell transplants or gene therapy can halt the disease, but only if done at a pre-symptomatic stage. Once symptoms begin, childhood cerebral ALD is almost always irreversible and fatal. The most famous reference to ALD is the 1992 film Lorenzo's Oil, based on the true story of Lorenzo Odone and his parents Augusto and Michaela. Lorenzo's story is extraordinary. He survived decades longer than expected, dying at 30 years old in 2008. Batten Disease. Batten disease refers to a group of fatal genetic disorders called neuronal ceroid lipofuscinosis, NCLs, which cause progressive brain degeneration in children. It is deadly because it leads to irreversible loss of brain function, resulting in seizures, cognitive decline, and early death. Most forms are inherited in an autosomal recessive pattern. Mutations in at least 14 different genes, CLN1 to CLN14, disrupt the cell's ability to break down and clear waste. As a result, harmful storage material, including ceroid lipofuscin, accumulates in neurons, leading to widespread cell death in the brain and nervous system. Symptoms usually begin after a period of normal development. Early signs include vision loss, seizures, and subtle behavioral or learning changes. As the disease progresses, children experience cognitive decline, motor dysfunction, and complete blindness. Some subtypes begin in infancy and cause rapid regression, seizures, and death by early childhood. One FDA-approved enzyme therapy exists for CLN2, but for most forms, care is purely supportive.